This is a study of the German Dermatologic Cooperative Oncology Group. The principal investigator is Professor Stadler from Minden, and the data will be presented in the afternoon by Ulrike Leiter, who's with me in Tübingen. Now, we addressed the question whether complete lymphadenectomy in melanoma patients with positive node is of benefit for the patients. And we planned this study and we made a sample size calculation in order to detect a survival difference of 10% for distant metastasis-free survival. So we found that we need 558 patients to answer this question. And in order to include 558 patients into the study, we had to screen 4,650 patients with sentinel node biopsy. We planned to do this within 6 years and then have 3 years follow-up. Recruitment was more difficult than expected, and we needed 9 years in order to recruit 483 patients. Now, the arms of the two study groups were well balanced for all factors: gender, age, tumor thickness of the primary, tumor load within the sentinel node, and ulceration of the primary. The result was that we did not find any differences between the two study groups in respect to survival. So distant metastasis-free survival was nearly identical for both groups, and there was a 0.3% difference after 3 years. Same is true for overall survival, melanoma-specific survival, and for recurrence-free survival. There was one small difference in regard to recurrences in the sentinel node basin. So there were 14% recurrences in the observation group and 8% recurrences in the sentinel node, the complete lymphadenectomy group. So even the benefit for the control of the local basin was small. So we conclude this is the first study which tested the general recommendation of complete lymphadenectomy in patients with positive nodes. We cannot confirm this recommendation, and we expect that the surgical praxis will change. Thank you.